I know right now I can just start going through my head the number of patients who I've seen here who all of them would have been dead or had serious long-term problems had they not had this facility here. And I'm just one person.
Across the country, rural clinics and hospitals have been forced to close due to the soaring costs of healthcare. Montana providers have thus far avoided this fate, though it's not out of the question. The Garfield County Health Center in Jordan has managed to stay afloat with a series of mill levies.
And we just don't want to be that next one on the block. We're trying to keep open and save lives and show compassion to the community that we can do this.
Is it safe to say then that the Garfield County Health Center was in danger of having to close the whole facility?
Yes.
The challenges facing Krista Wright and other rural hospital administrators are many. Geographic isolation, difficulties recruiting staff, and low patient volume. And changes to health insurance policy at the federal level are likely going to make things harder. President Trump's H.R. 1, known as the Big Beautiful Bill, is estimated to cut $911 billion out of Medicaid over 10 years nationwide. That could be $5.4 billion less for Medicaid in Montana, with 31,000 people potentially losing their coverage.
You know, what we know is that rural hospitals, rural health clinics, federally qualified health centers that serve rural Montana are operating on extremely narrow margins. So many of them are actually operating in the red or close to it. We would expect if there's a big increase in uninsured patients, that's going to be hard on hospitals.
These Medicaid reductions will mostly be the result of new work requirements and more frequent eligibility checks. The state says it will take 40 to 50 new full-time employees to tackle the oncoming deluge of paperwork.
So there's now a very complicated process that states will have to go through for every patient who's enrolled to verify that they are either working or volunteering or exempt under one of the many exemptions that Congress included from that. It takes a lot of state capacity to do that analysis well. And so part of the projection is a lot of people who actually remain eligible and are either working or exempt are going to lose coverage just because of that sort of increase in bureaucratic red tape.
And so unfortunately, what we find is that when people don't have health insurance, costs for everybody go up because uninsured patients will eventually seek out care, and then it gets provided to them in the most expensive setting. And if they don't have insurance to cover that, those costs get spread around to everybody else who does have insurance through incrementally higher premiums. And so it's the most inefficient system, and it leads to, unfortunately, the worst outcomes.
Knock, knock. Hi, how are you? I'm doing pretty well. How are you?
The One Health network of community health centers stretches across eastern Montana and Wyoming and is based in Bighorn County.
In Montana in general, and certainly in Bighorn County, we have a lot of folks who have behavioral health needs. Mental health, substance use disorder. Unfortunately, we see the demand, the need for those services increasing everywhere across the state. So in a community where there's a lot of folks who are struggling with addiction or with mental health challenges, and then we have to do all the paperwork to maintain eligibility for Medicaid, it becomes even more challenging for sure.
At One Health's Hope Clinic in Hardin, staff members offer support for the folks Mark is talking about, including Kennard Black Eagle, who should easily qualify for Medicaid. For one, he's a tribal member, a clear exemption left in H.R. 1.
I had Medicaid when I was a kid, but I haven't really got into that in a long time.
And why is that?
It's really hard out here, like to get a ride, to go get my Social Security, and like some natives like me are like illiterate, like we don't know we don't really know anything about ourselves, really.
Without insurance, Black Eagle is unable to get into a treatment facility. Instead, he goes to the emergency room at the Bighorn Hospital.
I at least go like once a month, for withdrawals or anything like that. Like they help out, but like you said, it's really expensive. I think I owe like a lot of money, and I think it's stacking up, and sometimes people don't want to go, because they keep going so much and they owe so much to the hospitals.
When Medicaid expansion first passed in Montana in 2015, it presented an opportunity to study the question, what happens to a healthcare system when more people can get insurance?
A lot of our analysis is focused on Medicaid claims. So we've seen, for example, that when people gain coverage in Medicaid over the first few years of enrollment, their use of emergency services and inpatient services decreases, and their use of preventive services tends to increase. The other thing that we really saw was that this helped the healthcare system provide better for the needs of Montana communities. So we saw, for example, in a survey of about half the critical access hospitals or the rural hospitals in the state, that almost every one of them added new services after Medicaid expanded. And this was because they have a revenue source to reliably pay for those services.
While Medicaid expansion reduced the number of people without insurance, it also led government healthcare spending in the U.S. to double to 14% of GDP, far more than any other country. For their troubles, Americans can expect to live 3 years less than in comparable nations.
Right now we finance healthcare by paying for widgets, basically. So the more surgeries that you do, if you're sick, our healthcare industry makes money off of you being sick. We do surgeries, we do interventions, they're quite costly. Sadly, we make money off of people being sick. Until we can start aligning paying for health, and instead of paying for sickness, we're going to continue on this pathway.
Representative Gillette voted against continuing Medicaid expansion in the 2025 session.
ACA has not been a friend to rural health, unfortunately.
How much of a friend H.R. 1 will be to rural health is still up in the air. To get the bill across the finish line, Congress included a 5-year, $50 billion grant to H.R. 1 called the Rural Health Transformation Program, and directed states to use the money to make one-time transformative investments. $1.2 billion is headed to Montana.
And the hope is that collectively we'll be able to invest those dollars in ways that yield a lasting benefit. Now, when we're considering decreasing a pretty stable revenue source in health insurance and Medicaid to one-time infusion of dollars that hopefully will yield some sustainable changes, I think we all collectively have to be pretty creative.
I can't think of one item that we could invest in that is truly one time only and doesn't have to be sustained. Whether it's loan repayment for nurses or behavioral health professionals, like, okay, we do that for the 5 years, and then what happens after that 5 years? Organizations are going to come to the legislature and say, we'd like to continue this program. But I think we can recognize that our healthcare system, we need the little Jordan Montanas to exist. We absolutely have to. At what level, we can have a conversation about, but it means that we need to push more funding towards them.
The Rural Health Transformation Program isn't the only way to push funding to smaller hospitals. The Garfield County Health Center has decided to convert to a rural emergency hospital, which means they'll cut expensive inpatient services in return for higher reimbursement rates and a $280,000 monthly payment from the federal government. On top of just keeping the lights on, that money will allow Krista Wright to bring Robert Knighting on as a second full-time nurse practitioner. He had been visiting as a travel nurse.
With our provider that's coming on board, we're able to offer a few more services with his training, being able to take care of pregnant women.
And she's got a list of services she thinks the Rural Health Transformation Program money could help with as well. CT scans, dialysis, physical therapy.
Mental health is a big one. We would really like to get a doctor in that can do mental health to take the burden off some of the stress from these people, and there's a lot of it out there.
But having those services doesn't count for much if people can't get health insurance. For Kennard Black Eagle, the alternative isn't pretty.
Me, I lost all my family, to addiction. There's a lot of people lost just like me, so all you gotta do is just be right beside them. That's it, They just someone needs to know that I'm there with you, and that helps a lot.
After talking with Black Eagle, I learned his Medicaid application was denied due to issues with documentation. Back in Jordan, Robert Knighting has his own struggles with insurance, even as he helps others.
I wrestle so much with it because people need help, but it's like ever since Affordable Care Act came out, like for me, what they did is they've passed that on all to middle class, and so I spend out of pocket $14,000, and I just found I'm going to get a 20% increase in my premium.
Though the business of healthcare has only become more convoluted, the basics of providing effective care hasn't changed much.
That's why I like the rural health. We ask the questions, we go through the stuff. What can I tell you or teach you that you can do now?
As we wrapped up our conversation, a nurse knocked on the door.
If they're ready and motivated to do something.
Mm-hmm. Was that knocking on the door?
I was.
Okay, we can.
Sorry, we got a kid just come in and cut his finger with a bandsaw at school. Probably stitches.
Okay, I gotta run. Thank you.
Once again, Robert Knighting and the Garfield County Health Center to the rescue. For Impact, I'm Sam Wilson.